Bismillahirrahmanirrahim. Assalamu alaikum. Today we will discuss short essay questions and some university MCQs regarding juvenile nasopharyngeal angiofibroma. In previous videos, we have talked about in detail about this tumor which affects the teenager males exclusively, and the links for those videos are there in the description. So let's see which one is the first short essay question regarding juvenile nasopharyngeal angiofibroma. The statement which was provided states that this is a teenager male with complaints of recurrent profuse epistaxis, that there is intermittent profuse nasal bleed and nasal obstruction, along with there is a swelling on the right cheek. So profuse epistaxis, which is recurrent with nasal obstruction in a teenager male, and this particular male has got a swelling on his right cheek. So first question, what is your diagnosis? So the disease which comes in our mind, first of all, that is juvenile nasopharyngeal angiofibroma. So let's try to answer these questions one by one. Juvenile nasopharyngeal angiofibroma is our provisional diagnosis. But why we came to this conclusion? Because theoretically we know that though this is an uncommon benign tumor of the nasopharynx, but it is extremely vascular. So, and secondly, it occurs exclusively in males, and those males are usually teenage males. So in the given statement, the patient is 18 years old male with profuse repeated epistaxis, which should be due to this vascular tumor, and this arises from the sphenopalatine foramen. And its typical presentation, we know that it has got two cardinal symptoms, and these two cardinal symptoms are intermittent unprovoked profuse epistaxis and nasal obstruction, which is mentioned in this particular statement as well. And then there can be other symptoms, like because of repeated blood loss, chronic anemia is quite expected. Then according to the extension of the tumor, there may be involvement of the orbit. It has gone into intracranially as well after eroding the skull base. As in this particular case, there is a third symptom as well, that this patient has a swelling in the right cheek. So it means the tumor has extended, originated from sphenopalatine foramen. From there, it has extended to pterygopalatine fossa, from there infratemporal fossa, and it has gone into the cheek. As far as the second question regarding the important investigations, first of all, because the patient is having repeated epistaxis, so we will go for complete blood count to see the baseline hemoglobin of this patient, and this may be requiring blood transfusion later on, so we will go for blood grouping and cross matching. Then mainstay of treatment is of course radiology, and in radiology CT scan is the treatment of choice. But if plain X-ray we do request for, we will see what it is called Hallman-Miller sign. Hallman-Miller sign is that soft tissue density mass which will be pushing the posterior wall of the maxillary sinus anteriorly. But still CT scan and MRI will be more helpful along with the angiography, but biopsy is contraindicated because of its high vascularity and the danger of brisk, profuse hemorrhage. Angiography may be 4-vessel angiography or carotid angiography. This will show us the vascular nature of the tumor, its feeding vessels, extension of the tumor, and in addition, during angiography, we can do the embolization, which will be helpful if later on surgery is being planned. Biopsy is contraindicated because of absence of muscular coat of the vessels. So they cannot contract and bleeding could not be stopped. Now give the treatment of this case. The question is this case, not the treatment of angiofibroma in general. So keeping in mind in this particular case that this particular boy has got a tumor with a mass in swelling in the right cheek. So it means the tumor has already extended. Because the treatment will depend upon the staging of the tumor, and because this particular case there is a cheek swelling, so the tumor already has gone from the pterygopalatine fossa to the infratemporal fossa, from there into the cheek. So the tumor is already, we can say, it is type 3 tumor. Of course, the CT scan will confirm our clinical findings. So when it is type 3 tumor, and overall we know that the treatment of choice for angiofibroma is surgery. So what type of surgery or what type of approach for surgical excision in this particular case we have to adopt for will depend upon the staging, and staging we have decided that it is already type 3. Now general surgical principles applies here also, that the tumor location and its extent, then pattern of vascular supply, effectiveness of embolization, surgical approach will depend upon all these factors including the expertise. And options which are available for us is endoscopic surgery or open surgery or a combined surgery. But as far as endoscopic surgery is concerned, we know that it is feasible and applicable for type 1 and type 2 and very mild initial stages of type 3 when there is limited medial invasion of infratemporal fossa. But in our case, the tumor already has gone into the cheek, so it means it has invaded whole of the infratemporal fossa, and from there it has gone into the cheek. So endoscopic surgery may not be feasible for this particular guy, so we have to go for open surgery. So again, in open surgery we have got so many options, that is transpalatal. Again, for a transpalatal approach, we know that is applicable only to the type 1 or type 2, but here it is extensive one. So we have to go for a combination of, and the combination of will be transpalatal and lateral rhinotomy approach. And if someone is not interested in these, because these will give us extra scarring over the face, over the palate, then we can think about the midfacial degloving surgery or midfacial degloving technique, which is better than transpalatal or lateral rhinotomy approaches because of the exposure it gives. Here we can remove the anterior, medial and posterior walls of the maxillary antrum and a very large cavity that is confluent with the nasal cavity and postnasal space, and whole of the tumor can be removed easily. So the answer, what treatment for this particular guy, this question I am talking about, one liner, surgery, and the surgery will be either transpalatal plus lateral rhinotomy or midfacial degloving. Another statement is there. A 14-year-old complains of recurrent profuse epistaxis. Again a teenager male. They have not mentioned the male here, but recurrent profuse epistaxis. On examination, he. So he means it is a male. Looks anemic. And a mass is seen in his nasopharynx. So again, what is the diagnosis? Teenager male who is anemic with history of recurrent profuse epistaxis and a mass in the nasopharynx, our provisional diagnosis is juvenile nasopharyngeal angiofibroma. Investigations, same investigations which we just talked about. Now the treatment for this one, because here in this particular case the mass is seen in his nasopharynx. So what impression we do get is that still the tumor is confined to the nose and nasopharynx. So endoscopic surgery will be the treatment of choice for this particular case. And if endoscopic surgery is not available or expertise is not available, then we can think about transpalatine approach only, which will be sufficient to deal with the tumor in this particular case. So this is how we have to tailor our plan for a given patient. Another statement, a 14 years old boy has got right side nasal obstruction that is progressive in nature and massive nasal bleeding off and on. Again, recurrent, profuse, intermittent bleeding is there. On examination, a mass is present in right nostril and also of right cheek. So this presentation is almost the same which was there in the first SEQ we discussed. So again, a teenager male with profuse repeated epistaxis and a mass in the nose and in the cheek. Our provisional diagnosis again is the juvenile nasopharyngeal angiofibroma. How we will confirm our diagnosis? That will be confirmed by CT scan and MRI plus angiography. Biopsy is contraindicated in a suspected case of juvenile nasopharyngeal angiofibroma. If same mass extending into the cheek, mention its root. So what is the root? That theoretically we have discussed already. You can check it out in those videos as well. Briefly, I will describe it here. It is arising from the posterior part of the nasal cavity, from saphenopalatal foramen. From there, medially it can come to the nose, nasal cavity and nasopharynx. Laterally it can go into the pterygopalatine fossa. And from the lateral pterygopalatine fossa, it can go to the infratemporal fossa and then into the cheek. So this is the anatomical route of its spread after originating from the saphenopalatal foramen. The foramen, as we know, it is the posterior medial corner of the maxillary sinus, posterior part of the lateral wall of the nasal cavity, purely into the superior meatus in more than 35 to 82% of the cases. In some cases it can be there in ethmoidal crest, and in 2 to 9% of the cases it may be on both sides of ethmoidal crest, but usually it is there in the superior meatus. Another SEQ states that a male child, again 14 years old, teenager, again with his recurrent epistaxis and right-sided nasal obstruction for last 6 months, mass in the right nasal cavity and nasopharynx, which is lobulated and pinkish in color. So gross morphology has also been described here, lobulated and pinkish. Again the diagnosis. So teenage male with recurrent epistaxis, with a mass, with nasal obstruction, juvenile nasopharyngeal angiofibroma. How will you investigate the case? Same investigations and treatment again in this particular case, because the mass is still confined to the nasal cavity and nasopharynx. So we can deal with or excise it through endoscopic endonasal surgery or transpalatine approach if we are opting for the open surgical procedure. Now I am leaving you with a few multiple choice questions, and I would love to hear your answers in the comment section. So this is an exercise for you. Saphenopalatal foramen lies posterior to bulla ethmoidis, middle turbinate, superior turbinate, inferior turbinate. For nasopharyngeal angiofibroma, the most appropriate investigation is angiography, biopsy, CT scan, MRI scan, or plain X-ray? What is not correct regarding nasopharyngeal angiofibroma? Affects only females, affects teenagers, causes nasal obstruction, epistaxis, varivascular. Question number 4. A teenager has a mass in his nasopharynx that has minimally spread into sphenoid sinus with no lateral extension. Which stage of nasopharyngeal angiofibroma could this be? Stage 1A, stage 1B, stage 2A, stage 2B. Waiting for your answers in the comment section. Please share it with your friends, subscribe the channel for further notifications, and thanks for watching.